Okay, so today I'm going to be demonstrating how to insert an IV catheter on a patient. Because all the people who live in my house are mushroom hunting at the moment, I have to use this stuffed lion that's kind of small because it's the only thing I could find. So we'll make it work. So the first thing I would do is gather all of my materials. Once my materials are gathered, that you can see here for my IV start, I would then go and assess my patient, check the vital signs, and then I also want to let the patient know what's going on, because you always want to let the patient know what is going on. And then when it comes to the medication, as I demonstrated in the prime tubing video, I have all of that primed there. It's all good to go, but we want to make sure we label it with the patient's name, our initials, the rate, the time, the date, all of those great things. So we have all of that primed there, so now I'll go ahead and then I'm going to put on my sterile gloves because this is a sterile procedure. So I would don these gloves. My tubing fell. But this isn't the tubing video, so I'm going to continue on. Sorry, I'm supposed to be not putting them down there. Okay. Get this out of the way. So I have my patient here, and I would take his arm. It's a he, I think it is. And I would take his arm, and basically I'm going to go almost all the way halfway up the first part of the arm. So basically halfway, but not quite halfway. I'm going to put the tourniquet on my patient about 4 to 8 inches above where you are palpating and checking for a good spot to insert the catheter. So basically, once the tourniquet is on, I'm going to palpate. I found, you find a good vein, and then I'm going to go ahead and I'm going to remove the tourniquet for not only the patient's comfort, but for like blood flow and stuff like that. And then I'm going to get my little cleaner here, my little cleaning swab. I'm going to clean the area that I anticipate to insert the IV catheter in. And then after I do that, I will go ahead and reapply the tourniquet, so that way we can get a good vein to pop out of there when we're palpating. So after I do it again, just make sure you can see the vein again. Make sure to grab your needle. Make sure not to touch the needle or anything, close to the needle. And we insert it into our patient here, and once it is inserted, keep it stable. And then you'll grab this deal here, grab your little tape or covering, and put it over the top. You want to make sure you label it with your initials, the date and the time that you did that. So once that is put on there, that's basically on. So what you want to do is you can go ahead and take off the tourniquet for the patient, and then with our bag that would normally fall, you can insert it into this catheter or any other medications that you're supposed to administer. Obviously, there's other procedures and policies and things you have to do to do new medicine and stuff like that, but there is how to insert an IV catheter.